Hello everyone, welcome to KNO Academy. This is Miss Aishwarya, your FON faculty. So today we will be dealing with the topic blood transfusion and we will do all MCQs related to it. Okay, so we'll start with, so what is blood transfusion? So we'll start with blood transfusion. First of all, we'll see the definition. Okay, so what is blood transfusion? Replacement of what? Of blood or its components for restoring of blood volume or to raise hemoglobin, raise HB, or to treat the deficiency of plasma and clotting factors. So to restore all these things we are doing replacement of blood. Okay, so that procedure is called as blood transfusion. So we'll see the various type of blood products. What blood products are available? First is RBC or PCV. Okay, next is whole blood, then comes the fresh frozen plasma, platelets. Okay, so about RBC and PCV, it is needed to restore the oxygen carrying capacity. Okay, oxygen carrying capacity of the blood. 1 unit will increase how much? 1 unit increases 1 gram per dl of hemoglobin and hematocrit by 3%. So once you have administered, after 4 to 6 hours you will check the HB. Okay, after that, this period of time only the HB will increase, otherwise before it won't increase. Each unit of RBC or PCV contains 250 to 470 ml of RBCs. Okay, and the transfusion should be completed within 2 to 4 hours. Okay, so next we will see about the whole blood. Whole blood, it is used to treat hypovolemia in cases of massive bleeding. Okay, in cases of massive bleeding. In this, each unit contains 350 ml of blood. Then we will see the fresh frozen plasma. So fresh frozen plasma is used to replace coagulation factors. Okay, coagulation factors. So it can be used in emergency for hemophilic patients. Then it is also used as an excellent blood volume expander. Okay, blood volume expander. So it can be used in severe dehydration or burn if you don't have blood available, so you can use this. So FFP should be infused within 2 hours of thawing and after 15 to 30 minutes it should be infused. Okay, within 2 hours of thawing and infused to the patient as soon as possible in 15 to 30 minutes. Then in FFP you have to keep in mind that ABO and RH compatibility. Okay, ABO and RH compatibility should be seen before transfusing FFP or other plasma products. So each ml contains 200 to 225 ml each unit of FFP. Then platelets. So what do we see in platelets is it is used in severely thrombocytopenic. Okay, thrombocytopenic patient. Thrombocytopenic patients. For example, less than 40,000 per DL in hemorrhagic patient or less than 10,000 in patients who are not yet bleeding. Okay, each unit contains 50 to 70 ml. Okay, it comes in 5 packs. So total will be 250 to 300 ml. It is stored at room temperature. You have to administer within 15 to 30 minutes after receiving. Okay, enough about platelets. We'll move forward. We'll see some types of plasma products. So types of plasma products includes, first is albumin, second is cryoprecipitate, and next is IVIG, that is gamma immunoglobulin or antibody. So albumin, it is used in hypovolemic shock. Okay, hypovolemic shock or liver failure or in cases of hypoalbuminemia. Okay, it is stored for 5 years. Stored for 5 years. And each 25 grams per 100 ml is equal to 500 ml of plasma. So we'll move on to the cryoprecipitate. So cryoprecipitate, it is stored at 4 degrees Celsius. Okay, it is also one more important point is that it is prepared from FFP. FFP and used in bleeding disorders to replace the clotting factors. Mainly what? Fibrinogen and factor 8. This can be stored up to 1 year. Next is IVIG. IVIG we will see over here. So it is used in gamma globulin deficiency. What are the conditions for donation? Condition for donation of blood. First is the donor must be free from infectious diseases like malaria, HIV, hepatitis and STD. The donor's vitals should be normal before donation. Donor should not donate the blood in last 90 days. Okay, that means 3 months. So the normal interval for blood donation is 3 months. Then the age should be between 18 to 65 years. Good general condition. Donor should not be pregnant. In last 6 months. Hemoglobin should not be less than 12 gram%. Blood should not be collected in empty stomach. Okay, and give sweet drink after donation of blood. Next we will see the types of blood donations. Types of blood donation. So first type is autologous. Second is blood salvage. And third is designated donor. So in autologous, the name itself tells us that the donation of client's own blood, okay, own blood is means collected before any scheduled procedure and then given back to the client. Collecting and storing a patient's own blood several weeks, 5 weeks, okay, before any anticipated need, and then you have to give it back to the patient itself. And it can be made every 3 days. Donation can be made every 3 days until the H becomes normal. Okay. Next is the blood salvage. So blood salvage is an autologous donation that involves suctioning of blood from various empty spaces. Okay, they will collect blood from empty spaces in the body. Okay, joint spaces or other closed body sites, and it is also a collection of the siphoned blood that has escaped from the non-affected site, and it can be filtered and given back to the patient. Last is the designated donor. It is a donation by compatible clients. Next is we will talk about blood bank. Okay, so a blood bank is what? A place where all whole blood and certain components are processed and stored, which needed for transfusion. So how they collect blood? In a sterile container, which is having anticoagulant solution. Like citrate phosphate dextrose or ACD. ACD is what? Acid citrate dextrose. Blood is stored at 4 degrees Celsius for maximum of 40 to 45 days. And heparin is used as a preservative. Bank blood should be used as soon as possible, because the longer it is stored, the fewer red blood cells survive to the usable form. Okay, what precautions you will take while doing blood transfusion? Precautions while doing a BT. So in the first 15 minutes, you have to slower the flow rate. Okay, limit it to 50 ml. Except when you are treating massive trauma patients. Okay, you have to use the filter size of 40 micrometer. You have to ensure that cross match has been done and that the blood is compatible to the patient. Okay, always there should be 2 healthcare providers. Okay, one should be the administering nurse, and the second one can be a doctor or a nurse. So second one has to verify the patient's ABO and RH blood type and compatibility. Blood is infused at room temperature but stored at 4 degrees Celsius. So you have to remember that never use any solution or drugs except NS when you are giving a BT. Only NS can be used. You have to complete the BT within 4 to 6 hours after you get from the blood bank. Once the transfusion begins, the blood is administered within maximum of 4 hours. If you are doing a rapid transfusion of cold blood, it can lead to cardiac arrhythmias. That's why you have to assess the patient for every 15 minutes. And always use a 18 gauge needle, 18 gauge cannula for blood transfusion. So the most important part is complications of blood transfusion. Complications. First is the acute hemolytic transfusion reaction, that is type 2 hypersensitivity reaction. What happens in acute hemolytic transfusion reaction is It usually develops within 5 to 15 minutes of transfusion due to ABO and RH incompatibility. Okay, what are the signs and symptoms? Maybe fever with chills, hypotension, chest pain, headache, patient may complain of dyspnea, tachypnea, diphoresis, and red urine, that is hemoglobinuria. Okay, cause is what? Wrong cross match. Or you have freeze the blood for more than 21 days. Mixing with the dextrose or excessive warming. This may be the causes. What actions you will take in case of this type of reactions? You have to observe the patient closely. For first 10 minutes. Okay, you have to immediately stop the transfusion and keep open the IV line with the NS. Inform the doctor and the blood bank. You have to monitor vitals every 5 minutes. To assess for shock or any collapse. Maintain IV infusion with NS. Okay, so that you have to promote diuresis and use a new IV set. You have to administer antihistamine as ordered by the physician. And collect the first voided urine blood unit, tubing and the filter and give it to the blood bank. Then next type of reaction is delayed hemolytic transfusion. Reaction. So it develops days to weeks after the transfusion. Of RBC antigen. Other than ABO grouping. Next is the pyrogenic reaction. What happens in pyrogenic reaction is, it is due to the presence of pyrogenic substances. In the transfusion tubing, and therefore you have to use septic techniques in the procedure, and if in case of improper refrigeration or any improper use of administration of the blood, therefore it can happen. It is characterized with fever with chills, diarrhea, nausea and vomiting, delirium and shock. Next reaction is allergic reaction. It develops during the transfusion. Or within 1 hour due to sensitivity of individual to the plasma or transfused blood. It is characterized by rashes, itching and laryngeal edema. You have to administer antihistamines and corticosteroids. Sometime allergic reaction may be mistaken for hemolytic reaction, so without a thorough investigation should be treated as hemolytic reaction. Next is the anaphylactic reaction. So it is very rare but may be life threatening. It may cause severe respiratory and cardiovascular collapse. Immediately you have to stop the transfusion and start resuscitation. Then others are circulatory overload. Circulatory overload. So when you give whole blood to a client who need only RBC or its other components, you are giving the whole blood in anemia, for example. So what will happen? The volume of the blood can be reduced. It's like there will happen a circulatory overload. So in this case, what you have to do is the volume of the blood can be reduced by giving diuretics. Okay, you have to administer diuretics and by exchange transfusion. You have to slow the rate of infusion and inform the doctor in case of circulatory overload and keep the patient in upright position. And the feet should be dependent. Next is the iron overload. Iron overload or hemosiderosis. Okay, hemosiderosis. So due to frequent again and again transfusion of blood leads to increased iron in the body. Okay, so 1 ml of blood contain how much? 1 milligram of iron. So hemosiderosis is what? It is abnormal deposition of the iron rich pigment, that is hemosiderin, in various tissues like liver. So for that you have to administer deferoxamine, okay, which is an antidote to iron overload through IV or subcutaneous route, so that excessive iron should be removed through the kidney. And this drug will give you red color urine, okay, because iron is getting excreted in the urine. Then next is hyperkalemia and hypocalcemia or citrate toxicity. So if you are using stored blood, which will cause hyperkalemia. Okay, why? Because the RBCs are getting destructed because of long stay of the blood, and as you know, potassium is a intracellular cation. So as the RBCs are getting destroyed, the potassium will come out in the blood stream. Okay, then one day stored blood's potassium level will be around 7 milli equivalent per liter, and for 21 days it will be around 23 milli equivalent per liter. So you can imagine. And next is hypocalcemia. So why hypocalcemia is occurring? Because the blood bag contains citrate. Okay, so when you are giving blood to the patient, this blood along with the citrate will chelate the calcium. Okay, that is why hypocalcemia may occur. Sign and symptoms include what? Spasm, muscle twitching due to what? Hypocalcemia, and high level of citrate may cause cardiac arrest. So for that you have to, how do you treat hypocalcemia? Is you give calcium gluconate, and for hyperkalemia you give Kayexalate. So these were the complications of blood transfusion. So I hope you understood whatever I taught you about blood transfusion. Now we can see the all the MCQs related to blood transfusion, and because of this theory you may be able to solve all the MCQs. So we'll start with the first MCQ on the topic blood transfusion. So what is the question? The blood should be stored at which temperature? Option is 2 to 6 degree, at 20 degree, at room temperature, and at 20 to 0 degree. So at room temperature is wrong. Blood can be infused at room temperature, can't be stored at room temperature. Okay, at 20 to 0 degrees. So we have seen in the theory part that blood can be stored at 2 to 6 degrees. So not at 20, not at 20 to 0, but 2 to 6. Okay, so this is the correct option. So generally blood is stored between 1 to 6 degree into the refrigerator. Okay, next question. So before giving blood transfusion, a nurse must note that the date and time of collection must be aware that the packed RBCs can be stored up to. Okay, so the packed RBCs can be stored up to. So the range is between 35 to 42 days. 35 to 42 days, and it can be stored at room at 6 degrees Celsius for up to 42 days. Okay, and platelets can be stored up to 5 days for platelets, and for FFP 1 year. So this is about RBC. 35 to 42 days. So 45 days is not the option, 55 is wrong, 25 wrong. So the option is B, 35 days. In an emergency, when the patient is unable to state his blood group, okay, so there is an emergency and the patient is not unable to tell what is his blood group. So in this situation, with which blood you can cross match the patient's blood group is AB positive, O negative, AB negative, A negative. So as O negative, is a universal donor. Okay, universal donor. So it can be used in emergency for cross matching. So option B is the right answer. Next question. Why are blood transfusions given? Okay, why are blood transfusion given? Only to increase the amount of blood. Okay, we have to increase the amount of blood. Only to increase the blood's ability to carry oxygen. Only to decrease the risk of bleeding. So among this, not only one option we have to choose, but these all three are correct. That is why our correct answer is all of the above. Next question is, for blood donation, a donor should have HB level above. So we have seen in the lecture, the theory part, that is, the answer is 12 gram %. Okay, it is direct answer. 1 unit of a blood contain how much amount? Okay, 1 unit contains how much? So it is 300 ml. Correct option. How often can a donor give blood? Okay, I told you already that there should be a gap of 3 months. That is 90 days. That the patient has not donated the blood to anyone. So C option is correct. Because it requires 3 months to recover itself and come to normal. So next question, there is a neonate who requires BT, okay, after birth. Which of the following cannulation site is most preferred? So now you have to see that the condition is related to the neonate. So in a neonate, the most appropriate cannulation site is umbilical cord. Okay, no scalp veins, no intraosseous, no subclavian, but umbilical cord. When you are administering a blood to patient, it is important to first administer each unit within 6-hour period. Use a volume control infusion pump to administer the blood. Run the blood at a slower rate during first 5 to 10 minutes. Draw blood samples from the patient immediately after each unit is transfused. So administer each unit within 6-hour period. So this is wrong. Okay, we have to give within this is right, but the most important is, they are asking most important. Use a volume control infusion pump. Yes, we have to use volume control infusion pump. Run the blood at a slower rate. Okay, so this is the very important point, because as we have seen complications, that acute hemolytic reaction may occur within first 15 minutes of transmission. So run the blood at a slower rate, that is 50 ml per hour during initial 15 minutes. Draw blood samples from the patient immediately after each unit is transfused. This is wrong. Okay, after each unit is transfused, it requires at least 4 to 6 hours to increase the HB. Okay, that is why this option is wrong, and our right answer is option C. Next question is, so now only we have seen that the BT should be started how many microdrops per minute and for how long. Okay, so just we have seen that it is 50 drops for first 15 minutes. Next question is, while administering a blood transfusion, the ideal nursing care recommended to identify blood transfusion reaction is inspecting 15 minutes after infusion is starting, inspecting at the end of transfusion, inspecting once every 30 minutes, inspecting whenever the patient complains. So this is wrong, this is wrong, this is wrong. Correct option is option 1. During blood transfusion, the most important nursing responsibility is what? Okay, draw a blood sample. No, this is not most important. Warm the blood to body temperature to prevent chilling. No, you don't have to warm the blood. Run the blood at a slower rate. Yes. Maintain patency of IV catheter with dextrose. Never. Never use dextrose solution. Okay, always use NS solution to maintain the patency. So option C is right. The following statement is true regarding transfusion of blood to a hemodynamically stable adult patient. Which statement is true, they are asking. So 150 ml of blood should be transfused in the 15 minutes. Wrong. They are telling to transfuse 50 ml per hour at the first 15 minutes. Okay. Blood should be administered slowly and completed not before 6. Wrong. We have to complete the blood before 4 hours. The transfusion should be completed within 4 hours. Yes, right. The unit of blood should be warmed at the bedside for 1 hour before starting infusion. Wrong. Okay. So as soon as the blood comes from the blood bank, you have to start giving it within 30 minutes. So option C is correct. A blood transfusion can be one minute. So a blood transfusion can be completed within 4 hours. Why they are telling to complete it within 4 hours? Because prevent a hemolytic transfusion reaction, prevent fluid overload, prevent bacterial growth, and prevent hypothermia. So to prevent hemolytic transfusion reaction, you have to closely monitor and infuse it slow for the first 15 minutes. Okay. So prevent fluid overload. So this is not the option. Prevent bacterial growth. So if you wait for more than 4 hours, what will happen? There will be increased risk of infection, bacterial growth. So unit of blood should be administered within maximum of 4 hours to maintain biological effectiveness. And limit the risk of bacterial growth. Okay, which can cause septicemia. Which solution the nurse infuses before starting a blood transfusion? So as I said, dextrose you don't have to use. Dextrose no, RL no, only 0.9% NS. Why? Because always use physiological normal saline before starting blood transfusion to prevent hemolysis of blood into the tubing. Never use dextrose solution before, during and after the blood transfusion. Which nursing action is most important before starting an infusion of packed red blood cells through IV? Weighing the patient as a baseline assessment? No. Finding out whether 18 gauge needle is used? Okay, right. Checking HB? No, this is not the nursing action. And clearing existing tubing with 5% dextrose? Wrong. So the right option is you have to check whether there is 18 gauge needle to prevent the damage of red blood cells and to provide smooth flow. Okay, to provide smooth flow of the red blood cells or whole blood. While receiving BT, the patient develops chills and headache. What should be the nurse's initial action? Okay, chills and headache. Patient is complaining of chills and headache. Notify the physician stat, stop the transfusion, cover the patient with blanket and administer acetaminophen and slow the blood flow to keep the vein open. First immediate reaction should be stop the transfusion immediately. Okay, because we have seen complications of blood transfusion. Any complication of blood transfusion, you have to stop the infusion immediately. So Mrs. Smith is receiving BT after total hip replacement. After 15 minutes, you went back to check her vitals and she complains of high temperature and back pain. So this indicates what? This is a reaction. okay, and not a normal reaction, but it is a very severe and adverse reaction. So option B is correct. It is not a renal colic, no urine infection, no common adverse reactions. Common adverse reactions will be febrile hemolytic, febrile non-hemolytic. Okay, from the following, the most common reaction to blood transfusion is what? As we have seen, I have told you that the most common is febrile non-hemolytic reaction. Which of the following infections agents can be transmitted through blood transfusion? Hepatitis, HIV, Plasmodium, all of the above. Yes, all of the above can be transmitted through the blood transfusion. Infectious agents like hepatitis C, hepatitis B, HIV, malaria and syphilis can be transmitted by blood transfusion. Although the causative organism of syphilis will not survive in this temperature of 4 to 6 degrees beyond 48 to 72 hours. What happens when you give rapid administration of blood which contains citrate? I told you citrate is a calcium chelating agent. Okay, as soon as she chelates the calcium, what will happen? Hypocalcemia. All are the complication of massive BT except hyperkalemia occurs, alkalosis occurs, hypocalcemia occurs and hypothermia occurs. So this is the except. So due to rapid or massive transfusion, the citrate present into the blood chelates the calcium, which may result in hypocalcemia. Which complication of blood transfusion? Hyponatremia, hyperkalemia, yes. Hypercalcemia, increased serum albumin, no. So this is the right option. Which drug you have to use anticipated by the nurse prescribed a physician to a child with frequent BT. So I told you, if anyone is receiving frequent blood transfusion, there is a risk of hemosiderosis. What is hemosiderosis? Increase iron overload. So antidote for iron overload is defroxamine. We have discussed it earlier. So the answer is defroxamine. Delayed transfusion related complication is what? What happens if you delay a transfusion? If you delay transfusion, iron overload will occur. So while giving a transfusion, venous spasm can be lessened by how? Keeping the patient arm warm, elevating container, clamping of the delivery tube, blocking the delivery tube. So vasospasm is what? It is a contraction or spasm of the vein as a protective mechanism when you are giving blood transfusion, which occurs after infusion of cold or irritating substances into the vein. For that you have to keep the arm of the patient warm. Donation of patient's own blood prior to his scheduled surgery. It is called as autologous, homologous, monologous, heterologous. So autologous is the answer. Effect of platelet transfusion is checked by, okay, that platelet transfusion is successful. How you can check? Reduced of oozing blood from the puncture site. If the blood stops oozing out, that means your platelet transfusion is successful. Which of the following area is not present in the blood transfusion services? So there is in the blood transfusion services bleeding room, cold room, therapeutic daycare room and component separation room. So all these 3 rooms are present, but this room is not present. Okay, so this is the answer. So this was all about blood transfusion. I hope you understood the theory as well as all the MCQs covered in this topic. Okay, so in the next class we'll come up with the other topic in the fundamentals of nursing. Till then, keep watching, keep learning. Thank you.